Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Essential principles and drug administration. The name selected by the original manufacturer based on the chemical structure of the drug is the Option A. Chemical name. Option B. Drug name. Option C. Generic name. Option D. Trade name. Right answer is Option C. Generic name. The chemical name is the chemical structure of the compound. The trade name is a proprietary name owned by the company that creates and registers it. The drug name does not exist. The interaction of one drug increased by the presence of a second drug is known as Option A. Potentiation. Option B. Additive effect. Option C. Antagonism. Option D. Synergism. Right answer is Option A. Potentiation. Potentiation occurs when the action of one drug is increased by the action of another. Think of two words potentiate and potential together. The potential of one drug is higher when a second drug is added to it. When two drugs given together have an effect equal to the sum of their respective effects, the interaction is known as Option A. Potentiated. Option B. Antagonized. Option C. Agonist. Option D. Additive. Right answer is Option D. Additive. An additive effect occurs when two drugs are given together and their effects is equal to the sum of their respective effects. Absorption, distribution, and excretion may be increased by which of the following diseases? Option A. Hypothyroidism. Option B. Renal insufficiency. Option C. Liver disease. Option D. Hypothyroidism. Right answer is Option A. Hypothyroidism. Diseases that speed up metabolism, such as hypothyroidism, will increase absorption, distribution, and elimination. B, C, and D are incorrect because diseases that decrease metabolism, such as hypothyroidism, renal insufficiency, and liver disease, will slow these metabolic processes. When a drug is 50% protein bound, it means that Option A. 50% of the drug destroys protein. Option B. 50% of the dose is at work. Option C. 50% of the drug is excreted in the kidneys. Option D. Protein must be restricted in the diet. Right answer is Option B. 50% of the dose is at work. The percentage of drug not protein bound is the amount of drug that is free to exert its effect on the body's issues. A, C, and D are incorrect because protein binding has nothing to do with the destruction of protein, drug excretion, or protein in the diet. Note that the concept of 50% bound literally means that 50% is bound or connected to protein. This means that the remaining 50% is available. Safety of a drug is determined by the degree between Option A. Therapeutic and toxic doses. Option B. Potency and efficacy. Option C. Subtherapeutic and toxic levels. Option D. Side and adverse effects. Right answer is Option A. Therapeutic and toxic doses. Safety is determined by the degree between therapeutic and toxic doses. Potency and efficacy are not related to safety. Subtherapeutic levels are not part of safety determinations because if a drug is subtherapeutic, it does not exert any desired effect. Side effects are expected, and adverse effects are often the result of toxicity. When a drug binds to a receptor to produce a pharmacologic effect, the drug may be called an Option A. Agonist. Option B. Antagonist. Option C. Blocker. Option D. Accelerator. Right answer is Option A. Agonist. An agonist is the action described in the stem. B and C are synonymous. Eliminate choice D because there is no such action described in drug nomenclature. The extent to which drug is absorbed and transported to target tissue is known as Option A. Steady state accumulation. Option B. Therapeutic drug levels. Option C. Bioavailability. Option D. Distribution. Right answer is Option C. Bioavailability. Bioavailability is the extent to which a drug is absorbed and transported to target tissue. Steady state accumulation means that the amount of drug present is sufficient to exert its therapeutic effect. Therapeutic drug levels are serum blood tests used to measure the amount of circulating drug present. Distribution is the process by which drugs are transported to tissues. Distribution is affected by Option A. Biotransformation. Option B. Excretion. Option C. Protein binding. Option D. Lipid binding. Right answer is Option C. Protein binding. Distribution depends on protein binding as well as circulation. Biotransformation is the act of metabolizing the drug. Excretion describes the act of eliminating the drug. There is no such thing as lipid binding. An unexpected effect of the drug is known as an Option A. Side effect. Option B. Adverse effect. Option C. Toxic reaction. Option D. Allergic reaction. Right answer is Option B. Adverse effect. An adverse reaction is a harmful and unexpected reaction. A side effect is expected and predictable. C and D are incorrect because a toxic reaction is a type of adverse reaction. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.